Hello, everyone. We're ready for a live with CCO. It's episode 31. We haven't done one of these for a while, and this is more of a casual get together to talk about things that we think are interesting, and it's kind of an open forum for you to ask questions live. Again, it's much more casual. Usually there's more than just one of us here. Of course, we got Boyd in the background, but usually there's a couple of us so that we can talk and chat and kind of give you two perspectives at once instead of just lecturing you on a particular topic. These are not necessarily questions that have come in that we're answering for you. These live with CCO, again, besides being casual, it gives us a chance to talk about things that are on our minds. So not, like I said, not necessarily questions to be answered. And the topic that we were going to talk about today is coding congenital disorders. And I've told people the best way to think about the codes for congenital anomalies is to think that when a person is born quirky, so they're unique, they're different, and congenital codes start with a Q in ICD. Again, if you ever see a code that's the first character is a Q, then you know that person was born with it. So again, fun, quirky, that's how I remember it. There's some things you need to know about congenital anomalies. The first thing is congenital, ultimately, when you break down the definition, it just means you were born with it. You're born that way. And it could be a lot of different things. The fact that your eye color is what it is congenital. You were born that way. Your hair color is congenital. If you have a toe that's longer than, like if the second toe is longer than your big toe, that's a congenital thing. Some people have that. I know my grandbaby that's been here for a while was looking at his little feet, and he's got one of his toes that is, his second toe is shorter than all the other. It looks kind of funny. And so we were looking it up to see if it means anything, and it doesn't mean anything. In fact, you may have looked up what is the shape of your feet or the toes. Does it mean something? And they come up with hypotheses, but the fact is it means nothing. It just is the way you were born. Now, other things, attributes about your body do mean things, like you may have seen people that had two different colored eyeballs. Yeah, that is a congenital anomaly. And even though it looks really awesome and it's unique, it comes with some other attributes that aren't so pleasant. One of them is people that have that are predisposed to deafness. So that's one thing. And there's some other congenital things. So if you are born quirky, it can affect every body system. And that means you could have something that's a congenital anomaly about your skin, about your respiratory system, your cardiac system, the gastro. Every single system of the body can have an anomaly to it that you're born with. And therefore, when you go look at the codes for congenital anomalies, it starts at Q00 and goes all the way to Q99. That's a lot. It fills those up. Now they've got room for adding codes, but there is room for growth because ICD-10 allows that. Another thing you need to know about congenital anomalies and coding them is that there's no time limit on the code. So just because you were born that way doesn't mean that it was discovered when you were born. It might be discovered late in life. It may not be discovered until you die and they do an autopsy and then they open you up and it's like, oh my word, look at this. It's a congenital anomaly that we never knew about. So therefore, when people get into coding and they're new, they think, well, it has to be identified as a child because you were born with it. So they think that that's what it means. It has to be discovered as a child, but that is not true. It just means you were born that way and you can't change the way you were born. The other thing to note is that it never leaves you. So think of things like a cleft palate. If a baby's born with a cleft palate, then even though the cleft palate is repaired, they always have they were born that way. So that will stay with them forever, that diagnosis. So it would be a history of a cleft palate, or it would be a congenital diagnosis that stays with them. And one of the reasons that's extremely important to keep in mind is that when you have a congenital anomaly, like having the two different colored eyes, there are other hidden anomalies usually that you're predisposed to have if they discover it and having it tested. I've known a couple people that were born with that, and I'm sorry, that is a diagnosis I can't remember the name of. Somebody can Google it or look at it. If you, off the top of your head, if you know what it is, type it in the chat and let me know. You're probably screaming it at the screen right now, because I knew somebody that had that. She had a blue eye and a brown eye, and she hadn't lost her hearing, but she goes in and she has her hearing checked every year because of that. And she was in her 30s, her mid 30s, when I knew her or lived next to her. And so there are some other things that she had to be very careful with, because whenever you have something that you're born with that is outside the norm, therefore an anomaly, that means there's probably other things. So I could have added under never leaves you, it's usually never alone. Like two different colored eyes, congenital anomaly, which also makes you predisposed to be deaf, deafness. Things like having Down syndromes, that's gives you genetic or congenital anomalies. And there's a whole list of attributes that are associated to that, as well as physical attributes, and as well as other congenital anomalies that are associated with usually heart conditions and some others. So if you're curious about the different anomalies and the different Q codes, I would take time to look into them and study them. Now, we're not going to go over them all today because, again, there's so many to go over that we can only highlight it and give you the basic information. So just remember, congenital means you're born with it. You're born that way. It can affect anything and everything in the body, all the body systems. There's no time limit to the discovery or the code, and it never leaves you. That Q code follows you forever. Even if they do a repair, it's still on your record. It stays with you, because in the future they need to know that you were born with that anomaly so that they can look for other problems if they were to occur, or uniqueness, quirkiness. Here are some of the most common congenital abnormalities. And again, Q00 through Q99, they are congenital heart disease. We're going to talk about them because that is one of the more common ones that I'm familiar with, and ones that you'll see in just average coding. Okay, when you're doing charts, especially if you're doing auditing and you're looking at more than a year's worth of documentation at a time or something, you'll see these things pop up more often, heart conditions, and some of them are congenital. So any abnormality of the heart, Down syndrome, actually very, very common. And Down syndrome is not only is it common, it's a chromosomal disorder. Okay, so they happen to know which actual chromosome is different, and that's pretty cool. Cleft lip and cleft palate. When you're going to get tested on Q codes, that's usually, they're going to pull out some type of a heart anomaly or cleft lip and cleft palate. The reason they do that is because there are so many codes, ICD codes for cleft lip and cleft palate. It is not just a cleft lip or a cleft palate. There are unique codes within cleft lip and cleft palate, and you can code them together. So it's combo codes. So again, that is, if you're getting ready to test for a coding credential, I would take some time to study that. Look into that some more. It's really fascinating. They even can now determine why children are born that way in some instances. And you've probably seen media where there's doctors and teams that go to other countries and do lots of surgeries and offer these surgeries free of charge to people that normally couldn't afford to have things like this done. And because it is a quality of life thing. You can repair a cleft lip and cleft palate. People who are born with cleft lip and cleft palates usually have other congenital anomalies in their body as well. Spina bifida, that is pretty fascinating. I actually know 2 people that have spina bifida. One was a friend of my daughter's. Now they're adults, but as she was a teenager, she was in a wheelchair and she was born with spina bifida. And then my daughter's mother-in-law was born with spina bifida, and they didn't discover hers until after she had her first child. And ultimately, it is a failure of the spinal cord to develop, and so therefore, the spinal cord could bulge out, or it's not trapped securely in the vertebra where it's supposed to be housed. It slips through because there is some type of developmental defect in the spinal cord itself or the vertebra. And so it can cause a lot of problems. Hers was in her lower pelvis. And again, she was raised that the pain that she felt was normal. She didn't know any different. She was an athletic person. So since then, she's had her back almost completely fused together and had lots of back surgeries and things to repair that. But you can see, if you do research, if you go to the right places to see, and if they have maybe late term miscarriages and stuff where they do like autopsies, and you can see sometimes where the spinal cord is just, or the vertebra is laid open in the fetus and it just didn't seam together. It's laid open. It would have been spina bifida. Sometimes it is a huge bulge outside the body of the baby, and it can happen at any area of the spinal cord. So spina bifida, very fascinating. Club foot, there are multiple, I think there's like 12 positions that the foot could be deformed or twisted. And so it's a malpositioning of the foot. And when a child's born, they can usually see that right away. But each one of those has a different name. We've done a webinar on that a long time ago. Well, it's probably not that long ago. And talked about each one of those positions and what they're called. This next one is hard for me to pronounce, but I'm going to give it a good, go. It's, phenylketonuria. Maybe, yeah. Ultimately, what this is it's a problem with the amino acids in the body, and it causes defects. If you don't know about this one, do some more research. It's pretty fascinating as well. When your body doesn't have the proper amount of amino acids, it can cause all kinds of problems in the body. Next one is Edwards syndrome, which causes developmental delays, and it's also a chromosomal issue. You have an extra chromosome of number 18, and it's similar to Down syndrome in that it's a chromosomal anomaly. Now, those are the main ones that are the most common. Okay, but there are so many more out there. So I picked a couple that I see in charts a lot, and I think that you'll probably see them divided up. If you're getting ready to test, you might see them in those categories. So let's kind of look at those. The first one is heart congenital anomalies. Now, there are several different types. And if you ever notice a younger person, someone that isn't old enough to have had a heart attack or a cabbage procedure, and they have a scar right here on their chest, they probably have they were probably born with a congenital malformation of the heart of some type. And I know several people that have had that. In fact, my cousin, her two sons were born on the same day, a few years apart from each other, born on the same day, both born with the same congenital heart anomaly. So that's fascinating, right? To have that happen. Anyway, the first one that's pretty common is a hole in the heart. Now, this hole in the heart, and I've got lots of pictures. That's for CCO Lives, casual fun stuff. But a hole in the heart can happen in several places. Ultimately, what happens is you're either going to have a hole between the atrium. So you've got the four chambers of the heart. So you got two chambers here and two chambers here. Atrium on top. So you think like the attic, the atrium, and the ventricles are down in the bottom. So you either have a hole between the two atriums or you have a hole between the two ventricles. Okay. Now there's some other places where you might have a hole, but when you hear them say that person, the child was born with a hole in their heart, that's what they mean. So those four chambers are meant to be completely enclosed with a valve between them, right? And when the valve, you can have mitral valve defects, you can have valve defects of the heart, but you can also have holes in the heart, not where the valve is, but actual holes between the chambers. Okay, but we got pictures to talk about that some more. You can have anomalies of the blood vessels themselves going in and out of the heart. Got a great picture of one that you're going to get to see. You can also have anomalies to the valves themselves. So the valves, are mostly just not allowing backwash, right? So when the top part of the heart pushes into the lower part of the heart, we don't want that to regurgitate and come back, because then it wouldn't be able to work effectively. And sometimes you're born with heart valves that are not adequate for whatever reason. So let's look at the codes to go with those. If somebody has a hole in their heart, it's going to be a Q21 hole code. Unspecified is a 9. If a person has a problem with the blood vessels of the heart, it'd be a Q26. Now, whenever you see the point dash, that means that there's other choices. You have to expand that code. And Q21, there's a 0.0, 0.1, 2, 3, all the way through 9. So again, I'm just giving you a area to look, to jump off from doing your own research. 2-3 is the valves, whenever you're born with a issue of the valves. Here's some pictures of what a arterial septal defect looks like. Now, arterial, because those are the atrium at the top, okay? And septum is the division between that tissue that divides the two chambers. You can see the two arrows, the color-coded arrows. We have other septums in our body. Your nose has a septum. It's a divider, right? You've heard of people having a deviated septum. That's what they're talking about. And so you have a septum, that layer of tissue that goes from the top of the heart all the way down to the bottom. So at the top, it's the atrial septum. And then at the bottom, it's the ventricular septum. So arterial or atrial and ventricular. septum, and you can see it's a hole in the heart that allows the blood to go back and forth. Now, when you look at the atrium, what it does is it mixes the deoxygenated and the oxygenated blood. So that's a problem. So we're not getting, not only is it being ineffective, it's mixing the blood so that we're not getting oxygenated blood out to the rest of the body. Right, it's seeping through. Whereas the ventricular septal defect, that's the power of the heart. So when you have a hole, it's like having a leaky bucket, right? And so it can't give it that force, that push, because there's a backwash, and so it can't. It doesn't have the power to get the blood, the deoxygenated blood, where it needs to go, and it doesn't have the power to get the oxygenated blood out into the body itself. Another really common one, and I know somebody that has this, is the tetralogy of Fallot. I can't remember. It's French. It's called a TF. And what happens is there's multiple things that happen with the heart here. We have the pulmonary tract. It's narrower than it's supposed to be, so therefore it's almost like a little stricture or a narrowing. The ventricles, the muscles that are around the ventricle chambers, get really muscular, like Arnold Schwarzenegger, so they're too powerful, and they don't have the endurance that it takes to do their job properly. Also, the aorta is not connected in the right place, and there is often a hole, a ventricular hole there. So again, this is what it should look like, and there is what it looks like. So this vessel right here has got a stricture, and when it has a stricture, that means the valve can't work properly. We have a hole between the two ventricles, and we have the aorta being attached down here low instead of up here high. So it causes a lot of problems, but it can be fixed with surgery. There is also a anomaly that's called a hypoplastic left heart syndrome, and when this happens, notice that we don't have a good valve here from the atrium to the ventricle, okay? And look at the left ventricle. It's itty bitty, tiny, tiny, tiny. So the right ventricle is way too big, okay? The left ventricle is very, very tiny, and therefore you cannot get proper blood flow at all. And see the right here, the pulmonary valve isn't even able to touch, it's so enlarged. So you get backwash. Yeah, there's several problems here that you can see. See how muscular this is? And it just has shrunk this up completely. And the mitral valve is just struggling to keep up with the pressure. And this valve over here is completely incapacitated as well. Yep, tricuspid valve, not even touching. This is an anomaly of the heart that I'm not sure, you guys will have to tell me if you see the anomaly. Okay, so let me just go back real quick. This is the aorta, comes down. Let's see if we can look at this previous picture here. Right here, see this right here? This is what you're looking at, this top part of the heart. Okay, now let's look there. What do you see that is unique about this heart? Good to see you guys type it in and tell me what you think. There should be only 3 vessels here, and there's 4. Now, this was not discovered until the person passed away. So it's a genetic anomaly or congenital anomaly that wasn't discovered until after death, and it wasn't the cause of the person's death. So anyway, this is pretty fascinating. I love stuff like this. There are lots of things that they don't discover about a person until after the person passes away. I wanted to add this. What a fabulous slide. And if you're in the CCO club, that's great because you get access to this, but you can go in and look at where I've cited, where I got all of this stuff. And this was out of Great Britain, an educational site that's over 100 years old. And what I thought was really cool about this is you look at the scars that people have, and where the scar is can identify what procedures the patients had. So past heart surgeries, again, I told you about seeing a younger person with a scar right here is going to tell you that they've had open heart surgery. It's called a median sternotomy. And if you look here, that scar, everywhere that you see the purple dot is a possible surgery. So aortic valve surgery, mitral valve, anything that's open heart, ultimately, that's how they do it. They cut you there, they crack the sternum, and they spread the rib cage so they can go right to the heart. Let's see, repair of transposition of the great arteries, Fontaine circulation with fenestration, repair of the TOF, central shunt, pulmonary artery banding. And so, yep, all of those, aortic valve surgery, mitral, yeah. So again, this could have happened as an infant, as a neonate, or, as an adult. Let's see, let's look at the red ones. Minimal invasive surgery, repair of a septal defect, tricuspid valve surgery, because the tricuspid is on that side of the heart. Let's see, it could be aortic valve, mitral valve that they possibly could have done. Over here, implantable electronic device, a pacemaker, a defibrillator, or a resynchronization device. I've been seeing a lot of charts that have a loop device, which strictly monitoring. It's about the size of a piece of gum, chewing gum, and they stick it in there, and it allows them to monitor the heart as if like they do with a pacemaker, but it's not a pacemaker. It's not doing anything to the heart except monitoring. And that's pretty fascinating. So it'll be right there under the skin. Let's see, let's go over here to this orange, right thoracotomy. That's a massive scar. So that pulmonary artery banding, or Blaylock tossing shunt. And also you have a left thoracotomy. Now, more things here. They can sometimes do mitral valve surgery for that, repair of the aorta. Let's see, ligation of a patent ductus arterius. And then the pulmonary banding and everything. What's really interesting is my son, my number one, who's 31 years old, he actually has a scar here, but looks a little bit different. It doesn't come over the chest as far, but his was not for his heart. It was when his lung collapsed. He had a double pneumonia in one lung, and they ended up going in and just kind of flaying him and scraping the infection and pus off of the lung and then stitching him back up. So he has like an upside down smiley face. It goes like this, and then he's got 3 portholes and stuff. So his was not a heart surgery. It was actually pulmonary. So let's see, chest drain scars. So his were not to do with the heart. So his are under his armpit. But if you have a chest drain, and again, anytime you go in and do anything invasive, you're going to end up with drains to allow the fluid to pass out of the body. I think that's all of them. This was just a fascinating one that I wanted to share with you when I saw that. It's like, yeah, this is gonna help you. Why? Because when you're coding, and they'll talk about the scars, and you're just like, wait a minute. I mean, that guy's got a scar right there under his, clavicle. okay, wait a minute, he's had some type of surgery done, right? Let's go find out what that is. You know, if he's got a median scar, well, he got something that happened with his heart. Did he have a cabbage? Did he have, what kind of procedures did he have on his heart? It'll help you find out what you need to code to the highest specificity. The other thing that's pretty common is abnormalities with the gentle urinary system or the kidneys. And here is a really good example of what could happen as abnormalities in the baby when you have kidney issues. Enlarged kidneys, okay, so way too big, enlarged bladder, club feet, hydrophoresis, and decreased amniotic fluid, small lungs. Again, these are anomalies that they can discover in utero. They can actually see. So let's talk about the kidneys. Common anomalies of the kidneys. These are Q6 codes, mostly Q60, but some of them are Q63 and Q62 codes. The first one is you're born without a kidney. That's actually that I don't want to say it happens more often than you would think, but it's pretty interesting, you know. And unless you're ever injured or you have problems that lead you to have more investigating done, you might not know it. Okay. They're again, if you've ever had a scan or anything, if they even do a chest x-ray, they might even, it gets low enough. It's like, wait a minute, is that there's no kidney there? Because the kidneys are actually in your back, very high up, extremely high up, actually. So, usually if you are missing a kidney, there could be issues. They would know. Then there is a condition called supernumerary, numerary, and you actually have more than one kid. You have more than two kidneys. So you could have an extra kidney, so a third kidney, or you could actually have an extra kidney on each side and have four kidneys. It happens. That'd be a Q630. Hypoplasia means that your kidney is smaller than it's supposed to be, so therefore it can't function properly. And of course, they have hyperplasia, so your kidneys are too big. Dysplasia means that the kidney didn't form properly. And there's even a condition called a fused kidney, which I've always heard this as a saddle or a horseshoe kidney. Actually, horseshoe kidney. If you go look up saddle kidney, it's not going to come up. Horseshoe kidney, but I've heard it referred to as a saddle kidney. And here's two pathology pictures of this kidney. Your kidneys are supposed to be separated, okay, and far away from each other, actually. But in this instance, in these incidences, the kidneys are fused together. Now, this can cause problems because it doesn't allow the kidney to function properly. And but there are times when it's not discovered. Now, if you want to know more about it, again, you can go Google it and research. There's tons of information and images, drawings and stuff, but it's pretty cool to see them, like the autopsy pictures and stuff, the pathology pictures of this. Another thing to keep in mind and is that your kidneys are really shaped like kidney beans, and these are really abnormally shaped as well as fused together. Anyway, and 1 in every 1,000 people, that's pretty common when you think about it. And you may never know that this was a problem unless you had some kind of a scan. We've got more questions coming in. Non-romantic. Claire. Oh, hi, Claire. One of my favorite people is Claire. Let's see, Vani. Mostly just people saying nice things. Yes. Okay. I see those two questions, and I will tell you what I know off the top of my head at the end. I have to think. I can tell you the difference between rheumatic and non-rheumatic, Whitney. But you asked about seromia iridis. I don't know much about that off the top of my head. You'd have to give me a hint, or I'll have to Google it for you. We'll see. I kind of pride myself in knowing some of these obscure things, but that doesn't mean I always know them. When I find something, it's like, oh, I got to go learn about it. And I did a lot of study about horseshoe, or what I called saddle kidney, when I had about a year ago. So that was pretty cool. Oh, this is a really neat one, the congenital hydronephrosis. Ultimately, nephrosis just means it's a buildup of fluid, okay, of the kidney. And if you see the pictures here, so you have a baby, and this is what the kidney should look like. But when you have a hydronephrosis, notice all of these ducts and nephrons in there, they're bulging and way too big. And where the ureter comes out of the kidney, it's bulging because there's a backup of fluid. Ultimately is why it's so big, and it can be bulging all the way down into the bladder. Okay, and this was a really cool image that I found. A particular doctor that does this, and I'll try to, I looked at it and made it really big so I'd be able to see it. This is actually arteries coming into the kidney to because this person's alive and not a cadaver, colors are different. This is the renal pelvis, which doesn't, that the renal pelvis is not a bone. Okay, it's a location of your anatomy. And let's see, normal ureter comes out, but see how big this is? This is where the blockage is happening, and it's made that way too big, way too big. So again, pretty cool. There's several ways to treat this, but ultimately what happens is the kidney can't function properly. Ectopic kidney, I know you've heard of ectopic pregnancy, and we think of the baby implanting in the fallopian tubes. So most people think that's what that means, but ectopic actually means something in the wrong place. That's what ectopic means. And so an ectopic kidney means it's not in the right place. Maybe it's too high, too low. Maybe it's where it's meant to suspend in the body there, it's not there. And what was an interesting fact is the left kidney is more predisposed to be in the wrong place than the right. So I'm not sure. There's another congenital anomaly that when everything in the body is flipped. Okay, so your right kidney's on the left side and your left kidney's on the right, but that's not all. See, we can tell because one lung has two lobes and the other lung has three. And also the heart leans to one side. Okay, and so when things are flipped, it causes problems. And a lot of other testing is done when that happens because it's an indication. These anomalies usually mean there's things that other things to be aware of. The heart may not be functioning properly, as well as the lungs and the kidneys. But ultimately, it's like a mirror image of the way your body's supposed to be. Pretty fascinating. One of our someone that we know from my husband being in seminary, their baby was born like that a couple years ago, and everything was flipped. I had not known anybody that had that. I mean, I've just read about it. So it's not ectopic. It is ectopic, meaning it's not in the right place, but everything is in its right place, but just on the wrong side. Okay, so that's I guess they would call ectopic, but it's got a specific name. I just can't remember what it is. You guys can tell me if you can remember what it is. But that's a Q 63.2, if it's in the wrong place. Notice also a pelvic kidney is the same code, Q63.2, and ultimately it means that the kidney didn't descend. So for little boys, you know how the testicles descend? Same thing. Your kidneys, after you're born, they start to descend down, and they sit in that renal pelvis, that area. Uh, if you have a rotated kidney, so it is on the vertical axis. So your kidney is like this, shaped like this. It actually tilts a little bit out to the side. So you have a kidney that lays like this instead, or I will lay like that if this is your ureter. So it's supposed to lay like kind of like this, lay out to the side, and it's a bean. I can't make a bean with my hand. Oh, there's my kidney, you know, and then instead of it laying like this up high, it lays like this. It's pretty cool. You can see x-rays of these two scans. A rotated kidney is what that is. And then they got an S-shaped kidney. Ultimately, this is like the this is also like the saddle or the horseshoe kidney, or it just mean that the kidney is shaped unusual. That S shape. Let's see, aberrant blood vessels just means abnormal blood vessels, the renal artery that will cause swelling, Q63.0 again. And then, so it's the renal artery is not formed properly. And then there's cystic kidney. Polycystic kidney is what you're seeing here. Notice, you know, kidneys are supposed to be, they look like a kidney bean. They're that same dark red kidney bean color. And these are very bad kidneys. No, so it looks like it's full of blue marbles, you know, or it looks like some kind of an alien thing or glob or something. All kinds of problems because the kidneys just aren't able to function at all properly when these cysts are in the way. If you have polycystic kidneys, then again, I don't remember what they do to treat that, but it's difficult. Maybe you'll be up for a kidney transplant. Q6100 is the code for that. They really urge you to go and look at some of these images because it's fascinating. Okay, let's go back to questions. Okay, so you said, let me see, I'm not sure if I can Google that or not, but I am going to try. Heteroscromia iridis. I don't know if I'm going to be able to. We're going to try it though, because my internet's not always the best. And then in the meantime, Whitney had asked, can you explain the difference between rheumatic and non-rheumatic? Whenever somebody has a rheumatic disorder, it's an immunosuppressant. It's a problem. And so when you see rheumatic with it, that means that associated with it, it has to have those rheumatic qualities, immunosuppressant disorder. Okay, so if it's non-rheumatic, so you can have a disorder of the mitral valve, and if it's caused because of the immunosuppressive disorder that the person has or is born with, then it would be rheumatic versus non-rheumatic. Okay, so I've got mine up, HETEROCHROMIA Let's just see what I get. Let's see if I can tell you. Oh, that's it. Yes. Is this a disorder? Yes, it is. That's it. Okay, so let me just bring that over to you guys. That's it. Okay, now this is not two colors in one eye. You can have even split like this. Well, it can be called that. But let's see. Genetic condition, it can be a growth on the iris, and that's the color part of the eye. And let's see, but it may be seen with other disorders. Let's see, the one eye might be a different from the other eye, for example, blue and a brown. I did see a blue and a green one time, but usually it's a brown and another color. That's distinctive. You can see that. Let's see the causes. Let's see if we can just look here and see the side effects, the congenital. It's benign. Let's see, health complications. Oh, it can happen later in life, but you're still born that way. And some mutations, a rare type. I think let's find us a really reliable source. Well, we like WebMD, but that always leads to cancer, so we have to be careful. I don't go to them very often. Scientific American, that would be good. No, I'm going to go up here to the government one. Here we go. Genetic and rare diseases information. We can trust that. Yeah. Okay. Other names. Let's see. Okay. It's one thing to have, like I said, two colors going in a circle. When you have the eye split with one color on versus another one. Situs versus, yes. That condition is called situs versus. Insitus versus, thank you.
Your social media team agrees with you.
I'm trying to look at the other sign, the other problems that occur. Deafness is the one that I remember. Now you can have other things that cause it, like glaucoma, but glaucoma whitens the eye, right? Yeah, like a cataract, you know, and but trauma to the eye, if you can, when people have had surgeries of the eye and the pupil is misshapen. I do know one of the grandchildren that was born when we were in St. Louis, not one of our grandchildren, when he was born, he had cat eyes. The pupils were split up and down like a cat eye. And that's another genetic anomaly. And I have to look and see what that is. That was really cool. Okay. Present from birth. Oh, here it is. Such as, this is what I was remembering, Waardenburg syndrome. Let's see. Underlying causes. Find a specialist, learn more, in-depth information. I wish it would just listed the other things and not such a little print so I didn't have to squint, guys. But you can go do other researches. I was thinking there was something to do with the heart that some people had, and they do percentages. Let's see, symptoms. Symptoms is just going to be different colored eyes. But, and again, it could be lots of things. You can go look up those other, this is rare diseases info, nih.gov. Okay, there's dots in between all of that, so you can definitely go and search those out. Okay, but you know, cool stuff. Let's see if this other one. Oh, here, maybe if it tells you if it's dangerous. I reckon it typically benign. No, or did we already other underlying conditions? Okay. Let's see. Anything else? Any other questions that you guys have for me?
That's all I'm seeing.
Okay. Well, good, good. Well, we did good. Don't forget that you can go into the help desk, not help desk, I mean the CCO club, and get the slides the slide decks and the resource page. You can ask questions, give us your comments. If you are familiar with a specific congenital abnormality that would be fun to study, let us know. And I'll go in and I'll go look up and see what the one is that the grandson had. Because I can't remember what it is now, and but it was really, really cool. He did really good, but they thought that he would have some problems, but he hit all of his developmental things, but he definitely, his little eyes were very unique, and he was very pale, and he had blue eyes, and those pupils were, you know, I don't know what you call that shape, diamond shaped almost, and it was pretty cool, pretty cool. So go out to cco.us/club, share your insight, and if you have a fun topic you'd like us to do for another CCO Live, let us know. Again, this is supposed to be a fun time. We were doing them on Wednesday nights, and then we got to where we were pretty busy and working on some other projects. So again, we want to give you what you need, and we only know when you tell us. Otherwise, I'll just talk about ICD all the time and what fascinates me, and you don't want that. Okay, bye guys.